Now for next up, I'll try to look at the epidemiology of chronic kidney disease. Epidemiology of chronic kidney disease. So for the epidemiology of chronic kidney disease, you're actually trying to look at the global burden of a disease. And for this context, you're actually looking at the chronic kidney disease, like the burden. That's like how far it has actually affected, the world at large. Okay, epidemiology of chronic kidney disease. So you could actually look at this picture, and the color coding here shows the severity. Okay, so countries like this, they're having the most severe. Just you can pause, observe the color coding, observe what you see on the globe. So let's go on and talk about it. Epidemiology of chronic kidney disease, you're just trying to look at pinpoint a disease, then look at how it has caused a lot of global health challenges. Okay, so it affects millions across age groups and regions. Okay, so CKD affects about 800 million people worldwide. So it accounts for about 10% of global population have chronic kidney disease. Just imagine. So in 2017, approximately 697.5 million people were having chronic kidney disease globally, with a prevalence of about 9.1%. So it actually rose, right? So it's one of the few non-communicable diseases with rising mortality rate. So most diseases that are usually of concern to us are diseases that we are saying they can move from one person to another. But this one, you can't move from one person to another, but yet it is deadly. Do you understand? So trends over time, in 1990, it increased about 29.3. Mortality rose by about 41.5. So since 1990, we're talking about from then till now. Okay, so the burden is expected to grow, and this is due to aging population. A lot of people now are aging, urbanization, the type of food we eat, the type of drugs we eat. Okay, increased rate of disease condition that usually affect the kidneys, like diabetes and hypertension. All of these are actually contributing to high cases of chronic kidney disease. So demographic patterns is more prevalent in older people. Women are mostly affected, racial minorities. So socio-economic status also comes there. So low and middle income countries bear a disproportionate burden. So they often lack all those resources to be able to prevent, and also treat CKDs. So key risk factors is diabetes mellitus, hypertension. They're actually the leading cause globally. So other contributors include glomerular nephritis, obesity, if you have been exposed to nephrotoxins, and all of that. Okay. So implications for public health is actually a major contributor to hospitalizations and increasing healthcare costs. Okay. So, but just for you to know that if you early on dictate or diagnose chronic kidney disease and you start treating early, right, you reduce all those complications that should actually come up later on in life. Okay, so that's it for this.